be on screen or off, whatever you prefer. This webinar will be recorded. Wonderful. Well, good afternoon and good morning to those that are on the West Coast. Thank you for joining our webinar today. We will give everyone just a moment to get on. Great, we have up to 70. Great. I'm Lisa Carr with I'm the public health analyst with the external engagement team here at SAMHSA. SAMHSA is the Substance Abuse and Mental Health Services Administration, and we're part of the U.S. Department of Health and Human Services. So thank you all for joining our webinar today on faith-based organizations engaged in overdose awareness. We are so pleased to have you all here. First, just a few housekeeping announcements. This is a webinar, and you are welcome to send in your questions using the Q&A section of the webinar. So you'll see that Q&A area with a question mark at the bottom of your screen. Go ahead and send your questions throughout the webinar, and we will answer them at the end of the webinar today. If you are a member of the press, please submit your questions to our press office at press@samhsa.hhs.gov. This meeting is closed to the press, and unauthorized recording is not permitted. Please note, this meeting is intended for invited leaders and guests from faith-based and community organizations, behavioral health, public health, and others engaged on mental health and substance use disorders. All participants are muted and should be off camera, except for the presenters. International Overdose Awareness Week is the last week in August. It's August 25 to 31 this year, and International Overdose Awareness Day is Saturday, August 31st. So this day is the world's largest annual campaign to end overdose. It's an opportunity to honor those who have died from an overdose, to reflect on the grief of those who are left behind. It's also an opportunity to raise awareness and to collaborate for the advancement of primary prevention, harm reduction, evidence-based treatment, and recovery support. SAMHSA has an international officer if you're working on international issues and your organizations would like to partner with SAMHSA. Our international officer is Robert Day, and he can be reached at robert.day@samhsa.hhs.gov. We are hosting this webinar today to provide resources and to equip faith-based and community members who want to learn what their congregation and community can do to make a difference with the overdose crisis. If we have about 2 weeks until the International Overdose Awareness Week and Overdose Awareness Day, if you want to implement any of these strategies by the end of August. We are pleased to see that national organizations like Sojourners and Christianity Today have recently written about the importance of churches having an all-hands-on-deck attitude. And Sojourners magazine recently wrote how churches can serve people who use drugs. We have SAMHSA subject matter experts and 2 of the top national faith leaders joining us today. They include Chase Holloman, public health analyst with the Center for Substance Abuse Prevention, will present SAMHSA resources, including the Overdose Prevention and Response Toolkit and the Harm Reduction Framework. Chase has served as SAMHSA's leading subject matter expert in harm reduction since 2021. Housed in the Centers for Substance Abuse Prevention, Office of Prevention Innovation at SAMHSA, Chase acts as an external liaison to partners and community collaborators, tracking on trends, promising practices, and challenges. And additionally, as SAMHSA continues to integrate harm reduction activities that support sustainable community-level harm reduction activities, Chase provides guidance and resources supported by evidence-based practices and community insight. Chase led the development of SAMHSA's harm reduction framework in collaboration with key community partners. Our next speaker will be Reverend Erica Paulette, MSW, MDiv, who's the founder and executive director of Faith and Harm Reduction. She is ordained and serves as the Minister of Harm Reduction and Overdose Prevention Ministries for the National United Church of Christ. As a faith leader engaged in long-term healing process from substance use disorder, Erica founded Faith and Harm Reduction to co-create a justice movement which connects people who use drugs, their loved ones, and communities of faith throughout the development of harm reduction, centered on spiritual resources, ritual support, and spiritual care. With a joint MDiv and MSW degrees from Union Theological Seminary and Columbia University in New York City, Erica is based at the Judson Memorial Church in New York City, and she serves on the board of directors of SAFEhouse Philadelphia and the Peer Network of New York. Our next speaker will be Karen Lowe, is co-founder of Olive Branch Ministry, a faith-based harm reduction agency in North Carolina. With a history of social justice advocacy that spans 15 years, faith is the motivator for Karen's work in harm reduction. Karen identifies as gender nonconforming, does not use pronouns, and believes that honoring a person's humanity and personal journey is vital to building successful relationship. Karen will share information on the Olive Branch Ministry, what congregations can do to prevent overdoses, and specific resources that would be helpful for congregations. And then we'll end the webinar with a brief question and answer period moderated by Jesse Heffernan, my colleague who's a regional behavioral health advisor in the Office of Intergovernmental and Public Affairs here at SAMHSA. So if you have any questions, please submit them using the Q&A function, and I'll now turn the webinar over to Chase. Welcome, Chase.
Thank you, Lisa. Going to share my screen here. Awesome. So hello, everyone. Thank you for being here. I'm super honored to be presenting on this panel here today with such estimable colleagues and mentors. Both Karen and Erica have taught me so much about harm reduction and faith over the last few years. I'm fortunate enough to have known them for quite some time. So today I'm going to talk a little bit about SAMHSA's support of harm reduction and overdose prevention, some of the resources that we have available that can be utilized. So first is this disclaimer and disclosure slide that I have to include in all of my presentations. This is just telling you that not everything I say is necessarily the views of SAMHSA or the United States government. So a little bit more about me. Whenever I get to talk to folks, I like to use this opportunity to do some stigma reduction. And that is by showing this photograph of me from December of 2012. If you can't tell, this is a mugshot. It was 2 days after Christmas, and I was arrested on pretty serious felony drug charges for conspiring to sell and deliver heroin. And I show that because that could have been an opportunity for a medical touch point, because by this time I'd overdosed 5 times, having my life saved by naloxone and other harm reduction resources. I had averted overdose numerous times by being prescribed buprenorphine, which is a gold standard medication to treat opioid use disorder. It reduces someone's risk for overdose by 40 to 60%. And then also had my recovery supported by a number of communities and peer support. I just have a couple here of schools that I went to that had collegiate recovery programs that enabled me to go back to school, getting my bachelor's and master's in social work, finding recovery, and eventually ending up here at SAMHSA. I also, before coming to SAMHSA, I did harm reduction service work in Greensboro, North Carolina. As I mentioned, I've known Karen for quite some time, and I wanted to show these pictures just to demonstrate a little bit about what this work might look like. So in these pictures are myself and a colleague doing some outreach, and then the 3 photographs in the center and the left are from Baptist Church, where we had our harm reduction program in the basement. pictured as a pastor, congregational nurse that we had that would see folks that would come in. And then some colleagues who are partnered with the university were there, and that is our supply room where you can see some of our supplies. On the right is a photo of a cleanup day that we did in partnership with a number of faith communities and with a local university. And the bottom right is at a local synagogue where we held an event in partnership with a number of organizations and screened a movie with the anonymous people. You can also see Michelle Mathis from Olive Branch Ministries pictured there in the lower right corner. So this is what harm reduction can look like in a faith community. So shifting gears here, moving towards SAMHSA. So what I have here is the Department of Health and Human Services Overdose Prevention Strategy. And if you look in this infographic here, you can see harm reduction is listed. And why I share this is one is that harm reduction is a key pillar of the administration's overdose prevention strategy. And what makes this extra special is that this is the first time in the country's history that harm reduction has been named this way and been considered such a key pillar of what we do in terms of supporting substance use disorder treatment, prevention, overdose prevention is by adding harm reduction as that key pillar. And I have some other efforts here on the right from that, including a national certification standard for peers. So why? The reason why is this really unfortunate graph, and I probably don't need a graph to tell you all because I imagine that most folks on this webinar right now either know someone or love someone who has lost someone to overdose or has lost someone close to them to overdose themselves. So for going on the third year, we've broken 100,000 deaths to overdose in the United States, which is exceptionally tragic. Here's a photo from International Overdose Awareness Day a few years ago at College Park Baptist Church in Greensboro, North Carolina, where the Syringe Service Program is. And you can see just, from this sort of small town, the number of people that came to honor their loved ones. Further, I wanted to share this additional slide with another scary line, and this is overdose deaths for fentanyl and non-fentanyl overdose deaths for children aged 15 to 19, how they grew from the years 2015 to 2022. Again, I don't need to tell you all, it is truly sad. Another reason we support harm reduction is this is a pie graph that is representing in 2021, we have the National Survey for Drug Use and Health that here at SAMHSA we administer. And it is the nation's largest survey that gets estimates of drug use and other things related to it in mental health in the country. And this statistic remains relatively the same for every year. I need to update it. Our 2023 was recently released. But in 2021, only 6.9% of people with a substance use disorder received specialty treatment for that substance use disorder. Again, just an abhorrent stat. So less than 1 in 10 folks with a substance use disorder receive treatment. And there are a variety of reasons for this. And harm reduction is a way that we can fill that gap. So also in the beginning of this year, in January, we released a document, which was the harm reduction framework. It outlines key milestones of harm reduction, honoring the background and history of harm reduction. It's important to note that at the federal government, we're pretty late to the party when it comes to harm reduction. Harm reduction was started in communities back in the 80s around the United States. It cites data, provides evidence and resources on the role harm reduction plays in reducing overdose and promoting wellness, and also outlines some pillars and supporting principles that guide harm reduction work. And here is our definition. And also on this photo on the right side, that is a QR code that you can scan and pull up the harm reduction framework. This is just a screenshot of the contents where you can see we also have some core practice areas in there. So you can get a sense of what this might look like in practice. What is the application of harm reduction? And then also what's been important to us is framing harm reduction so it doesn't get reduced to a certain service, as it often can if you're not familiar. So a lot of people, when they think of harm reduction, may think of syringe exchange programs or distributing naloxone, the drug that reverses an opioid overdose that I talked about before that saved my life. However, harm reduction is much more than this. It can also be framed as an approach. And this is important because harm reduction doesn't just have to look like those services, but it can be practiced by any number of organizations or faith communities. It is an approach that can be practiced, for example, here at the federal government. One way that we practice this is in the creation of this document, we did a lot of outreach with community partners, people in community directly impacted by substance use, leaders in the harm reduction community, by finding out what is the best way we can support. And that is an example of a harm reduction approach. And then also services, as I mentioned, and then entities. So these are community-based harm reduction programs. And the importance of these programs cannot be understated. So these are programs like syringe service programs that are ran by the communities they serve. I mentioned harm reduction started in the 80s in the United States. And how it started was people who were directly impacted by racist drug policy, by a growing HIV/AIDS epidemic, got together and supported one another because no one else would. And these organizations are so critical because of them being the people they serve, they have the most access to our community's most vulnerable people visiting harm reduction programs. That is often their only point of contact for medical or for health and social services. So they have unique access to folks that we desperately need. I showed the slide earlier about less than 1 in 10 people receiving specialty substance use care. When harm reduction programs are supported in communities, this is where folks can receive their care, whether that be substance use treatment, as often happens, if that's what folks want, or other social services or spiritual care, etc. And then I like this slide as it's pretty busy, but I think it's a good visual representation of a very complex subject. And that's that harm reduction is an essential part of, I hate to say this continuum, but this circle of care that wraps around a person, right? And a person might not necessarily need harm reduction services like syringes or something if they're not injecting drugs. They may be in a place where they need prevention, right? How do we prevent or delay the onset of risky drug use for youth? Folks might need treatment. Folks might need recovery support services. Folks might need harm reduction. But what we know is folks often fall through the gaps, and harm reduction really fills a large gap so that we can make sure that a person is always within a system of care. I also wanted to talk a little bit about our overdose prevention and response toolkit. Again, this is a QR code that you can scan and access it online. We recently revised and re-released this toolkit, working on it again in partnership with many leaders and experts across the United States to make sure that it is comprehensive. And we released that in a few months ago. Also, I'd like to mention this one is available in Spanish online. The harm reduction framework has been translated, and I don't think we posted it yet, but be on the lookout for that posting soon in Spanish. And here's a table of contents. So this toolkit really is comprehensive, and it is helpful and practical, and then it breaks it down into a number of audiences. You can see here in the appendices, it can be broken down for people who use drugs, what information specifically they might like to know, people who take prescription opioids, practitioners and health systems, first responders, and policies and systems considerations. Appendix 5, I think, might be especially helpful for faith communities or faith communities that are involved in their community's logistics or service offerings. There's a lot of helpful information in there about overdose prevention and response. And then everything before that is general knowledge that is just really practical and helpful for folks to know when thinking about overdose prevention. For instance, the different types of reversal medications that are available, like naloxone, the different formulations, calls folks might go about getting them, etc. And then also in combination with that work, in 2022, began working with states through a cohort model, 10 states at a time, to help them think about naloxone saturation and how to get that into the hands of people who need it most. And then, as Lisa mentioned, these slides will be available, but here's a number of other QR codes with various resources. So these are some recovery resources in TA that folks can get recovery resource TA from. Treatment and prevention. Here's a link you can see to the Opioid Response Network. I highly recommend visiting that or any of the TTCs or Technology Transfer Centers in the lower right-hand corner, as these are excellent direct TA resources. Then that's technical assistance that you can ask questions. Like for instance, if you are in a faith community and want to know how to implement harm reduction, you might ask one of these TA resources. And we're saving questions for the end. I'm excited to hear what Karen and Reverend Erica have to say. Thank you all.
Wonderful. Thank you so much, Chase. That was such an informative, helpful presentation. I'm now going to turn it over to Reverend Paulette, and I will be sharing her slides for her now.
Thank you so much, Lisa. And good afternoon. It's an honor and a pleasure to be with you all today and to be in conversation about the ways our communities of faith and their leadership can support the overdose prevention ministry that people who use drugs and people who love people who use drugs have given life to. In this way, I would ask that we commit to being curious and co-creative, seeking opportunities to draw connections with harm reduction ministers and ministries in our communities, and to engaging their leadership for our efforts. People who use drugs and people who love people who use drugs have built beautiful models for what ministry with one another might look like. So let us follow their lead. Next slide. As Lisa introduced me, I am here this afternoon on behalf of Faith and Harm Reduction and the National United Church of Christ's Harm Reduction and Overdose Prevention Ministries. Faith and Harm Reduction is a national collective of faith and community leaders who mobilize spirit, community, and power in partnership with people who use drugs, people who love people who use drugs, recognizing that for many of us, these are overlapping identities. Born from conversations with communities of faith, harm reduction organizations, and unions of people who use drugs throughout the U.S., Faith and Harm Reduction fills a unique role as connector, community mobilizer, and capacity builder, fostering innovative and previously untapped cross-sector collaborations to expand and strengthen harm reduction in principle, practice, and policy. Next slide. The United Church of Christ Harm Reduction and Overdose Prevention Ministries brings together pastors, lay leaders, theologians, people who use drugs, service providers, activists, and other collaborators in order to advocate for and increase the engagement of local churches in ministries led by people with lived and living experience of substance use, overdose, and other justice issues. Next slide. Last year at General Synod, delegates passed the first ever harm reduction resolution of witness, titled Faithful Advocacy for Intersectional and Transformational Healing and Harm Reduction, which sets precedent for the adoption of covenants which commit to harm reduction values and practices and build communities of compassionate care, hospitality, and advocacy in partnership with people with lived and living experience of substance use and overdose and their loved ones. It also encourages advocacy by all settings of the church for broader and more just access to harm reduction services and programming, including but not limited to syringe access programs, overdose prevention programs, expanded community-based naloxone access and distribution, overdose prevention centers, access to evidence-based drug treatment, and much, much more. Next slide. We recently were funded by NACHO, National Association of City and County Health Officials, and the Centers for Disease Control to partner with the National Survivors Union, the National Union of People Who Use Drugs, to identify strategies to engage Christian faith communities for overdose prevention in Appalachia and other areas of the U.S. experiencing disproportionate burdens of overdose fatalities. And the following emerged as key asks, opportunities, and actions that communities of faith can take to positively transform the narratives around substance use to ones which center compassion and the full humanity of people who use drugs. The first might seem obvious, but I'm not sure that its significance can be overstated. And that is a call to use person-centered, non-stigmatizing language when talking about substance use and people who use substances. This particular key message lies at the heart of our work, lifted up by people touched by substance use as being where they have experienced a significant level of harm connected to communities of faith and where they believe significant positive momentum can be achieved. In the Christian tradition, language is how creation happens, not as a meticulous engineering project, nor a work of magic, but entirely spoken into being. The word not only communicates the divine intention, it actively accomplishes it. A word created the world. We understand that our words also create worlds. We can create worlds where people who use drugs are portrayed as being less than human, diseased, as sinners, or we can create worlds which celebrate the full humanity of people who use drugs and which centers compassion, connection, and equity. Next slide. In continuing to think about language as a creator of worlds, here is our opportunity to create worlds in which none among us are at risk of dying from a preventable cause, and that being overdose. We have the wisdom necessary to ensure that no more beloved community members suffer the pain of loss from overdose. And we understand that this promise begins in community and courageous conversation. We have the opportunity and the obligation to have difficult conversations about all the ways our communities are made vulnerable to drug-related harm, including criminalization, racialized drug policy, and the stigmatization of people who use drugs, as well as to lift up the rich repertoire of community-led healing justice strategies, such as syringe service programs, overdose prevention centers, access to evidence-based drug treatment that are available to us and our loved ones as we seek to move towards any positive change and pursue healing in whatever way is meaningful to each individual, using any number of legitimate pathways to healing. Faith communities and our leadership have the opportunity to use our pulpits, our pews, our houses of worship to give space to and testify to the life-giving and life-saving ministry of harm reduction. And at the same time, to challenge narratives that overdose and substance use are moral issues, individual issues, instead recasting public awareness that overdose is a community health issue, a justice issue, a deeply pastoral and prophetic issue. Next slide. This next action connects to the previous slide and gets at some of the earliest conversations we had with faith leaders when we were a nascent organization. And that was hearing from faith leaders that they lacked the resources theologically, liturgically, pastorally, and prophetically to be able to engage the many issues touching their communities connected to substance use. It became evident early on that the development of resources for faith leaders that speak the language of faith and pull from congregational cultures was going to be critical to move not only faith leaders, but their ability to connect with their congregations as well, to support communities of faith and their leadership in holding these conversation spaces and hosting awareness events, including International Overdose Awareness Day events, Days of Remembrance for Lives Lost to Overdose. Our partners in our national collective have created a library of prayers, rituals, litanies of remembrance, service components such as sermon seeds, hymns, and much more, in addition to a range of theological one-pagers and conversation guides on harm reduction issues and questions of faith. In many spaces, harm reduction is stigmatized along with people who use drugs and people working in partnership with people who use drugs. And as culture creators, communities of faith and their leadership have the opportunity to educate ourselves and our communities about the myths and realities of harm reduction so that we might truly build congregations of compassion and care and ensure that all people have access to the resources needed to flourish. Next slide. I am thrilled that gatherings like this one today are happening, understanding that faith-based organizations and their leadership too often remain an untapped force in the work to address and heal the harms of the overdose crisis. And with the knowledge that each of you, each of us possess significant social capital and influence as thought leaders and have the power to change the narrative about the overdose crisis from one which dehumanizes and stigmatizes to one which is rooted in compassion, love, social justice, and which uplifts each of our full humanity. Additionally, communities of faith have rich history as leaders of social change. Faith leaders can have a substantial impact on human right protection for people who use drugs, access to harm reduction services, and the overdose crisis through prophetic advocacy, public witness, and conversation with decision makers. Next slide. And last but not least, or rather more accurately, this action item is at the heart and soul of the ministries that I serve and the harm reduction movement as a whole. And that is relationship with, community with, and centering the leadership and wisdom of people with lived and living experience of substance use and overdose throughout the life of the church and through the work of harm reduction justice. To support this action item, our Spirit of Harm Reduction Toolkit for faith leaders provides explicit opportunities to partner with and provide leadership opportunities across the life of the community and the life of the church, including 4 key areas such as expanding compassionate care, hospitality offerings, community building, collaborative advocacy, and resource development. And I'll showcase each of these in a little more detail in the next few slides. Next slide. And I'm going to move through these next slides quite quickly, and I'm going to point you towards where you can find these resources. These slides are more to give you a sense of the resources available to you as you continue to explore how to grow overdose prevention ministries in your unique congregational context. And this one in particular is a collage of a number of resources we have developed over time and are available to you in a variety of formats. In September, we are launching the Multi-Faith Alliance for Harm Reduction, which is a peer-to-peer database and info sharing network for communities of faith who are ready to, engage in actively establishing ministries which center harm reduction and the leadership of people who use drugs, and provides a range of resources and framework and network within which to do that congregation and community building. We've also got our Spirit of Harm Reduction Toolkit on here with a whole range of liturgical and ritual and prayer resources. In partnership with the UCC, we established the Harm Reduction Justice Sunday Toolkit for worship preparation. We have questions, conversation guides, webinars about how to introduce harm reduction and overdose prevention from the pulpit, as well as a whole collection of kind of congregational life resources like prayer cards that were developed by people who use drugs, people who love people who use drugs, people who have lost a loved one to overdose, which reflect the prayers and blessings they had wanted to hear, had wanted their loved ones to have a chance to hear. So next slide. And this slide and the next 2 slides are pop-outs from that toolkit I talked about and offer concrete and creative ways for how you might expand compassionate care, hospitality, community building, and collaborative advocacy in partnership with people who use drugs so that we can bring overdose to an end and ensure that all people hear their names included in the beloved community. The image on this page was just sent to us by a congregation we worked with in Lexington, Kentucky, and shows where they installed an overdose prevention kit, including the lock zone, on the outer wall of their church, not just the inner wall of their church, to both expand access to lock zone for a community impacted by lack of access to healthcare and experiencing poverty, and also to publicly communicate the worth and value that people who use drugs and people at risk of overdose possess. Other images we might have included are making worship space available to harm reductionists or unions of people who use drugs to hold their own services when sanctuaries are otherwise not in use, as Judson Memorial Church does when it opened its meeting room for the Harm Reduction Family Love Feast once a month, a spiritual community building service and shared meal led by and with people who use drugs. Next slide. In thinking about community building opportunities, this image is likely a familiar one to many of you. This one shows an overdose prevention, recognition, and response training, as well as naloxone, fentanyl, and xylazine test strip distribution, which was provided to thousands of UCC delegates and Synod attendees at last year's event in Indianapolis. It is our hope that we can train and equip all 5,000 plus congregations in our denomination to be overdose prevention ambassadors and supports in their community. Next slide. And this last slide is rich with ideas to expand compassionate care offerings in congregational settings, including expanding pastoral care resources for people who are parenting people who use drugs or have lost loved ones to overdose, making harm reduction supplies and other overdose prevention resources available in partnership with local and state health departments and harm reduction organizations, as well as rituals of remembrance for lives lost to overdose, hand-crocheted safer injection and overdose response kit provision, such as the ones our colleagues at Olive Branch provide, which I'm sure Karen will talk about, and so much more. Next slide. And quickly, some advocacy opportunities, and we share all of these kind of ongoing action alerts and advocacy opportunities as you share them with us, and as there are opportunities for faith communities across the country to share that with our networks. Next slide. And lastly, just want to say thank you. And at this point, I would love to turn it back over to Lisa, who's going to turn it over to Karen, and hope that you will receive this presentation as both an invitation into relationship with us, as well as an extravagant welcome to reach out to us to be in conversation about how we can help you expand harm reduction ministries in your communities. So thank you.
Thank you so much. This has been very helpful. I'm going to go ahead and introduce Karen, and I'll be sharing her slides. I'll do that now. So welcome, Karen. We're glad you're with us today.
Thank you. Thank you, Lisa. Thank you, everyone that is on this line with us and sharing in this conversation today. Thank you to all the other panelists, a lot of which I know. I am truly honored to be sitting in the seat having this conversation with each of you. My name is Karen Lowe. I am the co-founder of Olive Branch Ministry and a North Carolina certified peer support specialist. Next slide, please. A little bit about Olive Branch Ministry. Olive Branch Ministry serves 10 counties in the Piedmont Foothills region of North Carolina. We provide faith-based harm reduction services, technical assistance for faith communities. We do syringe access, overdose prevention. In those areas, we do low barrier Suboxone, low barrier Hep C treatment, mental health support. We do linkage to care. What we consider to be linkage to care is we like doing a warm handoff. We like to be with the individuals through as much of the process as we can, not just handing someone a piece of paper and saying, here, go figure it out, find out, or let us know what you found out. Also, we like to provide, and we do provide, harm reduction focused peer support in MOUD clinics and county government agencies. What we say is faith is our why and not our what. Now, what that means for us is this is why we feel and we do what we do. It's not a requirement for you to interact with us. Next slide, please. The introduction of harm reduction to congregations needs to reflect their interest and level of comfortability. We meet them where they are. Not every congregation wants to participate at the same level, but what we found out and what has worked best for us in our area is to ask, what are you comfortable with? What are you willing to do? What have you been a part of? What is it that you'd like to know more about? How can we better help you make this a conversation that you're willing to have with individuals or your whole congregation, or sometimes even a denomination? And that looks different in different areas, and it looks different at different times. Next slide, please. One of the things that is possible is this medication take back. You can use it to put the bulletin inserts. You can put it in your newsletter. You can have basic opioid facts and coordinate with law enforcement in your area. Next slide, please. Naloxone training, kit making, fellowship. You can hold an Naloxone 101 or an overdose awareness event, the blessing of the naloxone service or an event. Ask attendees or individuals to help put together naloxone reversal kits. This has such a wide range. Think outside the box. It's not tailored to one thing and is open to a lot of things, remembering not to do harm. As Erica spoke before, the medicine bags are made in partnership with a local group here. As you can see, or hopefully at the top, that is reflective yarn, and some of the items that can be put in these bags. The reflective yarn is mostly given to a lot of our people. Some would say homeless, some would say unsheltered, or those that are not in well lit areas. And that's the purpose of the reflective yarn. Next slide, please. Supply drives. As you can see here, this is one of our wound kits, but it's not limited to just these items. Supply drives are very important, and they're very beneficial to communities of faith, whatever that may look like and whatever they're comfortable with. You can help put, again, syringe exchange kits, different type of supply drives, work with communities that they're comfortable in. What does your community need? And I don't want to really get into specifics, but it's asking that question. What does your community need that we can put together and we can give back and show a partnership, show connection, show love and support. Next slide, please. Transportation ministry. We found out often during the week, a lot of congregations have church vans or buses that are not being used, or they have volunteers that want to donate time. With the transportation, we figured that some of the needs are getting people to their clinic appointments, some of their therapy appointments, visitation, sometimes even court. And this is another way that we can utilize this or possibly partner with a transportation ministry in your church or congregation. Next slide, please. Peer and volunteer-led group activities. This is not limited to, but we wanted to just put some possibilities out there. Art or music group, yoga, various types of exercise, social nights, games, free childcare for those in need. There are plenty more ideas and opportunities out there. Next slide, please. Support groups, families who are directly impacted, communities that are directly impacted, grief support groups, 12-step, celebrate recovery, people in various stages of the continuum, moral harm reduction works. Next slide, please. Syringe exchange services in partnership. Promote the building of trusting relationships with people who use drugs. Often the most difficult to get the faith community involved in. We understand that, but what we say is, meet us, let us meet you, and we can find a place that we can meet that helps everyone. Olive Branch was invited into a space at Northminster Presbyterian Church as a way for them to expand their outreach in the community. The picture you see here is actually a picture of our office at Northminster Presbyterian Church. This is the front of our office when you come in, and a lot of times the way we'll set up at events. Next slide, please. Again, as we partner with many organizations, one being Faith and Harm Reduction, and you can see a couple of the events that were possible. This one in the upper left-hand corner involved a group of individuals who came to the table, asked what we were about, what we were doing, and then started helping make naloxone kits. Next slide, please. This is what we say. A lot of people have heard, there but for the grace of God go I. What we believe is because of the grace of God goes I. I, me, we, all of us, by grace, we can do this together. We can have conversations that sometimes seem to be uncomfortable. We can find ways that we can meet where everyone can participate. We ask to expand the I. And that's what faith can do in faith communities. Expand the I. Make it a we. I thank each of you for your time and your consideration. At the end, you can see our email if you have questions at a later date. And again, I am very thankful for this conversation. I'm very thankful for not just this month that we have. And we remember those that have been lost. We remember those families. We remember those congregations. And we look forward to the conversations we'll have later today, tomorrow, and the communities that are now coming on board and saying, I want to be part of this movement. Thank you.
Thank you so much, Karen. That was such a powerful presentation. So thank you. We'll now open it up for questions and answers. And I'm going to turn it over to my colleague, Jesse, who will manage this part of the webinar.
Thank you so much, Lisa. And thank you to our presenters so much for sharing the information you did and some of your personal stories and the incredible work that you're doing out there, connecting with folks. And I also appreciate that in the Q&A portion, some folks have been vulnerable enough to share that they have lost loved ones, and we hear you and we see you. And that is a large reason why we're here today, to talk about how we remember folks and also how we can have preventative measures within our community. So again, thank you so much for being willing to share those things. A couple of the questions that came through, I did send some to the presenters, but we've had a few asking specifically about some of the resources you all mentioned. The Faith and Harm Reduction Toolkit, the Library of Prayers and other resources, as well as like any other things that you talked about. We posted some of them in the chat for SAMHSA specifically, but if you can talk about some of those resources, as well as maybe where's a place where folks can find like a number of them at the same time so they don't have to go fishing and Googling around for all of them. And that's to all of our panelists.
That's great. And I know that, or I believe that Lisa indicated she would be sharing some resources. And so perhaps as part of that, she can share contact info. I know she is going to share the PowerPoint presentation with you all, which has my contact information, which also has both of the websites that I mentioned, which point towards a number of both discrete as well as overlapping resources, including the Spirit of Harm Reduction Toolkit, some of the worship and liturgical resources. And again, my contact information is on there. I also saw that there were some questions around kind of making contacts with folks doing harm reduction ministry in local communities and jurisdictions. And those are also resources and connections we can help make if you want to reach out.
Thank you. Karen or Chase, do you have any other suggestions or recommendations where folks might find some resources in addition to what Reverend Paulette said?
Yeah, I'll let Chase share that one from SAMHSA.
I would just reiterate the TA centers that we had listed in those slides. You'll see the QR codes for them and also links to them. And then just echo what Reverend Paulette said. It seems like she has a lot of very targeted resources to this, and Karen as well. And I know they both have a ton of experience working directly with folks. And as you can tell from hearing them, this is what they do.
Thank you. In the beginning of the presentations, you had shown, Chase, a number of approaches and services that relate to harm reduction. And so this question is for all the panelists. When we talk about any positive change, what does that mean to you? And can you give an example of what that might look like in the terms of harm reduction? Anyone may
I'll
start.
go first on that one. Any positive change, I think we take it as what they said it was. Any positive change. The person gets to define what is positive for them and what is change for them. It's not my expectations or someone else's expectations. It is what they have set up for themselves. And so we accept it at face value that if someone says, I'm doing better, I know what I used to do. I'm doing better. That's good enough for us.
Yeah, I
That's
feel like
any positive change. It's open. It's not limited to.
Yeah, I feel like in so many contexts, to kind of double down on what Karen said, there have been these kind of expectations, explicit and or implicit, that people who use drugs make particular changes, behavioral changes or whatever, in order to be able to kind of claim space or be part of, whether it be, you know, different fellowships and or other kind of treatment and or healing spaces. And as I have experienced harm reduction and harm reduction in the context of faith communities, and harm reduction as a spiritual practice has been this kind of expansion of what we understand and how we understand healing happens. And that is entirely, as Karen said, is led by, is visioned by the person, the person themselves, but that this healing happens in the context of community as well. And that I feel like has been a really kind of critical piece when I think about any positive change, both as, you know, an experience of being a service provider, as also a person who was a service participant, and, you know, looking at all the ways that I was witnessed and walked with and provided opportunities for a whole range of kind of opportunities for connection and healing that literally had nothing to do with my drug use, but had a lot more to do with kind of claiming health and reconnecting to purpose and meaning and restoring relationships. And so I think any positive change, as Karen says, is exactly that. And it's led by whomever it is that is seeking that change.
Thank you. Chase?
I just want to echo what they said, and you know what the evidence and science tells us is that incremental change is change that sticks and more powerful. Expecting big changes overnight, whether someone's using drugs or trying to change the way that they eat, drastic change rarely succeeds very well, whereas incremental change accompanied with positive reinforcement, we see a lot of success. And I wanted to add just some real life examples in this context quickly. Thinking about my former program, I still volunteer with them, and I just wanted to share some stuff to think about this in terms of that. The reason we talk about syringe service programs in connection with overdose prevention, just to make distinct that relationship, is that from the evidence, 80 to 90% of all community reversals. So I mean, overdoses that are reversed by a community member in the United States are done by people who use drugs. And that 80 to 90% of that naloxone that was distributed to those people carrying out the reversals, the community members, was distributed by syringe service programs. So it's really important as our main and primary way to ensure that we get naloxone directly to where it goes and is responsible for saving those lives. And for example, my former program in the last year, in a county of 500,000, their participants, people who use drugs they serve, are responsible for over 1,000 reversals in that community. And that's annually over 1,000. And that's one of 2 harm reduction programs in the county. So there's another county responsible for even more. And that's just one representation. You know, there's harm reduction programs across the country with work like that. And I'd also echo that in the last year, they have over 200 people that are on buprenorphine treatment, low barrier, through their clinic where they see a provider. Not a single person in their program has died, which is incredible for this population dying at alarming rates. And they've connected folks, I think close to 150 at this point in the last year, to other forms of treatment and healthcare services. So that's why this stuff is so important. Like Erica and Karen have so eloquently put, having that relationship to get folks to services and life-saving medication.
Thank you. In the spirit of staying with any positive change, I think it also applies to all the folks on the webinar, right? So in closing, what's one small positive change you'd like folks to leave with in the midst of all the content that you provided? What's one small thing that you said, moving forward, here's an easy step for you, or here's something that you can start moving towards, again, in that spirit of any small change?
Well, I think it's showing up in these conversations, and it's being willing to have these conversations and being willing to break the silence around substance use and people who use drugs. And so really, I commend folks for asking the questions and showing up. I think that's the necessary first step.
I'm going to go with language. Words matter.
Jace.
Sorry. I was hanging on to the words already shared. I think just what was said, have a dialogue, talk about it with your family at dinner tonight, talk about it with your faith community on whatever day you practice, bring it up, talk about what you learned today, and connect with the folks on the screen right now.
Thank you so much. We've got about a minute left here, and there are some great questions that are coming through in the Q&A now. I'm hoping that we can capture some of those, and then when we send out some materials, we might be able to provide some responses to those. Things like giving naloxone or exchanging syringes, encouraging more drug use. Again, that's a very common question that comes up for folks. And I would just say, like, what we're doing is we're enabling life and quality of life through doing those kinds of things. So again, we'll do our best to capture those. And want to thank all of our panelists and for everyone for the questions. And I'll turn it back over to Lisa.
Thank you. Thank you so much. And I really appreciate everyone's feedback. And I really appreciate the questions. So we've read all of your questions. We'll do our best to respond to you. We have your email addresses. Our main email address for our faith-based office, for the faith-based work that I do, I should say, is at engagement@samhsa.hhs.gov. So I run faith outreach for SAMHSA. We have lots of people at SAMHSA doing faith engagement, but I kind of coordinate some of that. Thank you. And so it's engagement@samhsa.hhs.gov. And we really feel free to reach out. You can also reach out to my email directly at lisa.carr@samhsa.hhs.gov. This is just a series of webinars that we hold for the faith community, focused on what we're seeing in the country around overdoses and opportunities for you all to be engaged in everything from blessing of naloxone, of Narcan, naloxone, and blessing of that, training in that. You can get training through your community, through your city or your town. There's lots of stuff you could do. And so we've just given you some examples of what folks are doing on the national level, and we welcome keeping in touch with you all. We do have a newsletter that goes out once a month. You can sign up for that. I will send the link to how to sign up if you're not on that already, in a follow-up email. So there's lots of ways to keep in touch. We also have great social media at SAMHSA. We encourage you to keep in touch with us through our Instagram and Facebook posts as well. So thank you all who have attended the webinar today. I will be sending the PowerPoint slides, contact information for the speakers, and a recording of the webinar, we hope, will be posted on our YouTube page. Take some time to get that done. So we'll hope to send that out. And I also have a faith-based website. We also hope to post it on our faith-based website. So I'll send you all the links to that information. We know this is such a crucial issue. It's so life and death. And we know about, I'm raised Catholic, and the dignity of the human person, right? We want to save all lives. That's our goal, is to help save lives. So we are thankful. We're partnering with you all to make a difference here. And we especially thank our expert panels. Thank you so much for these amazing presentations you gave today. And we look forward to keeping in touch with you. So thank you all. And this does conclude our webinar for today. We hope you have a wonderful afternoon. Thank you.